Okay, good evening. My name is Jeannie Edikai, and I am a board member for Native Health, and I'm currently serving as the board president in support of Native Health. And I am calling this June 21 annual meeting to order at 5:15 p.m. on June 15th. We're going to start our meeting with a roll call of the board members. So as I call your name, please say here so that we can put you down for the record that you are here for our meeting this evening. Christina Brown, Vice President.
Good evening, I'm here.
Dr. Charlton Wilson, our Treasurer.
Hello, here.
Olivia Wanika, our Secretary.
Hi, I'm here.
Ms. Tanisha Sangino, our Member at Large.
I'm here.
Ms. Carol DeHozy, our QA Committee Lead.
Hello, I'm here.
Dr. Rishi Popat, a board member.
Hello, present.
Mr. Sean Sellers, former past president and board member.
Hello, present.
Ms. Brianna Jagleski, board member.
Hello, here.
And Ms. Elena Young, past president and current board member.
Yes, I'm here. Hello.
Thank you, everyone. I appreciate that. Welcome to our June annual meeting. Next up was going to be Walter Murillo, our CEO, with a message for everyone.
Hello, and welcome to the annual meeting for Native Health. My name is Walter Murillo, and I'm proud to be the CEO of Native Health. I've been affiliated with the organization for quite a while. I started as a volunteer board member, and for the past 20 years, I've been on staff. This year truly was a testament to this community organization. Native Health did what it was intended to do by our visionary founders. We've truly been a resource to the community in a great time of need. As an employer, we've managed to stay open. In fact, we've had to increase the size of our staff. As a community-based organization, we were able to pivot very quickly. And of course, as a healthcare provider, we were able to continue to provide services and also react to the new needs that the pandemic brought upon us. We also were able to maintain our wellness programs. Many of our programs this year utilize telecommunications in such a broad manner using existing technologies in order to continue to provide services to our patients and clients. I'm very happy that you've joined us for our annual meeting. This is the Board of Directors and Management's opportunity to showcase and highlight the remarkable efforts put forward by our staff and the resilience of the community in which we serve. We've heard from Jeannie Edikai, our board president. Now I'd like to introduce you to the other members of our board. Our vice president is Ms. Christina Brown. Our treasurer is Dr. Charlton Wilson. And our secretary is Ms. Olivia Wanika. Other members of our board include Ms. Tanisha Sangino, Brianna Jagelski, Carol DeHozy, Elena Young, Dr. Rishi Popat, and Sean Sellers. And also with us tonight are members of our leadership team, Ms. Deanna Sangster, our Chief Operating Officer, Cody Nelson, our Chief Financial Officer, Emily Nielsen, Behavioral Health Director, Dr. John Molina, our Acting Health Services Director and Corporate Compliance Officer, Dr. Diana Dunnigan, our Medical Director, and Jordan Begay, the Director of Community Health and Wellness, Susan Levy, our Communications Director, Angela Young, Director of Administrative Services, and Francie Spencer, our Development Director. There are many acts that I've witnessed at Native Health this year on a large scale and on an individual basis. There are so many that I probably couldn't get through them tonight, but I'd like to give you highlights of just a few. First and foremost, I'd like to thank the staff of the medical division. They continue to provide in-person services for our patients who weren't able to use the phone for a medical visit or whose condition required them to come in, or for our patients with barriers that just didn't allow them to use the phone. The medical division also pitched in and volunteered for our statewide efforts that Native Health joined. The statewide efforts included testing sites, testing events, not just in the area of Phoenix and Mesa, but also the Guadalupe Township, and also the Kaibab Paiute tribe of northern Arizona. When the vaccine became available, those testing teams quickly pivoted to provide the vaccine. I'd also like to call attention and thank the members of our Community Health and Wellness and Dental Department. At the beginning of the pandemic, they weren't able to continue to provide the services that they normally do. But they began pitching in for services such as food delivery, food distribution, transportation, and other necessary services. We're also fortunate that many of our staff were able to telecommute. Many administrative functions and programs like home visiting and WIC were able to work nearly 100% of the time out of our offices. This pandemic not only brought out the best of our staff, but revealed to us the support that Native Health has in the community. We received donations from Arizona-based companies, financial institutions, private foundations, and many individuals. We also received in-kind donations from many sources, from the fire department to individuals with homemade items. All of these remarkable acts can be seen in our annual report that will be presented later in the program by Ms. Jeannie Edikai. This is the second annual meeting that will be held virtually. I hope next year that we'll all be able to meet again, enjoy a meal and conversation together, and continue to move forward in a safer, healthier future. Thank you.
Okay, so next up on our agenda is going to be some information regarding a very important member of our team who is moving on to affect another group with just as much awesomeness as he has brought to our group, and that is Dr. Charlton Wilson. He has served Native Health since 2015 through 2021. He has been a leader on our finance committee, worked closely with our CFO to make sure that Native Health builds and maintains a strong financial foundation for today and tomorrow. He has been a great mentor to me, especially when I came on and was like, what are we doing? What are we supposed to be doing? So an avid supporter of Native Health, very kind, very generous mentor. And we take this time tonight to honor him for his service to Native Health. And we have also presented him with a token of our appreciation, although we're virtual, so that he has something to remember us by. So does anyone have anything else they would like to add to embarrass him even more?
Thank you, Dr. Wilson, for everything. I really also enjoyed my time with you at special events as well. So very nice to meet your family. And I do wish you the best. And I hope that we can reach out to you still and pick your brain on everything and get some great ideas. Thank you.
Well, thank you all. Madam President, every single member of the board, all of the members of the executive leadership of Native Health, and for those listening, the employees, every employee who I've had a chance to interact with or see them in action or meet them and their families at perhaps one of the big Christmas events, which is such a great experience. I want to say thank you for letting me be a part of this organization and contributing in some ways. And I am so confident in the future of this organization through its leadership and all its connection to the community. I know that your future is bright and you're in very good shape. I also want to thank everybody for this beautiful memento. It will remind me of each of you and our work together. Thank you very much.
Thank you so much, Dr. Wilson. We appreciate everything you've done for us.
Thank you.
Next up on our agenda tonight, I'm going to give you an overview of our annual report to the community. We do have a nice booklet that you can, I don't know if you can see it. I've got the camera on, maybe not. we'll share out contact information so that you get our annual report that highlights all the activities that Native Health has participated in over the last year. And to echo Walter and Dr. Wilson's comments regarding our staff, I can't say enough how our staff has really come up, rose to the occasion, pivoted, got creative. They didn't quit. They were on it. And we even had to hire more staff, as Walter had mentioned. We had a very busy year providing services, figuring out how we can do that, keep everything going, and learning of all the new people that needed services and how we can reach them and how we can support them. So I really want to give the staff kudos and applause for working through all of that. I know there was a lot of fear. There was family illnesses. There were passings in people's families, and we all had to support each other through those times. And having to move to remote work and having to be patient with change. Change is hard, even if it's small, but this was a massive amount of change in a very quick amount of time. So I just want to thank the staff and let them know that you are appreciated and you are a very, very important part of this organization. Next up, I want to just highlight a few things from some of our programs, just so you kind of know what's in our book, but I encourage you to read it from cover to cover. I have, and I think it's an amazing publication. It gives you a really good idea of some of the services that we have. So maybe there is something that you didn't know we had, and you'll find it in that book. You can always reach out to us and we would be happy to get you what you need. So Walter did talk about our medical team moving to virtual health, right? They still held the drive-through flu shot clinics. They still held the COVID vaccine. Well, they weren't really drive-through, they were walk-through COVID vaccines. They had the COVID testing. We had the rapid COVID testing available. We did 2,033 flu vaccines this year. We did 3,812 COVID tests this year and 11,197 COVID vaccinations this year. So that's a huge amount, a lot of work. My message would be just to, if you haven't gotten your vaccine, get it and continue to be safe as we start to reopen everything. Let's see, some other highlights from our medical. They did maintain many of our current programs that, you know, were used to meeting in person, such as our adolescent care program, our diabetes program. They partnered, as Walter has already mentioned, with several community servers and providers to get PPE early on in the year when PPE was becoming scarce. That's that personal protective equipment, masks and gloves and disinfectant and all that. So the community came together and helped provide us some of that. Our behavioral health team, they also moved to telephonic visits, and that turned out to be very successful. They still held their weekly talking circles. They held the virtual prayer walk, which that's one of my favorites, to go on that every year. They still worked with domestic violence prevention. I'm just amazed that they are able to keep these programs going amongst all of this craziness, right? Our food distribution, now that was a highlight for this year because the demand became much, much more this year. With jobs being uncertain and people being home, we did about 5,000 boxes a month. So over 60,000 meals in total over the past year. We were supported, of course, by St. Mary's, United Food Bank, Midwest Food Bank, and the Arizona Food Bank Network. Winco has donated to us. And we also provided boxes to our own staff. We provided 2,100 food boxes to support our very own team. We have our garden, which is still going strong. That garden provided 2,800 pounds of food this year, and we use that food in our food distribution. We also started a at-home Garden Warriors program. which provided seeds, right, to American Indian, Alaskan Native families, gave them a seed bundle so they could start farming at home. So the garden currently has about 30 farmers and families that participate. So if you're interested in joining our gardening team, please contact us at Native Health and we'll get you connected to the right people so that you can come out and help us grow healthy fruits and vegetables. Our community health and wellness program, they also continue to strive to provide all the services that they normally do during this pandemic. They didn't want to lose the ability to serve our folks, so they really came up with ways like WIC. They did phone and they did video. When they needed to, they did home visits. They used Zoom. We still maintained our kindergarten readiness, our virtual graduations, our educational videos, and then that very popular blue corn cookies and cocoa with Santa at Christmas time. They held that and it was amazing. We have book reading. It's online video now. You know, your kids can log in, or individuals can log in and hear a book read. Hooks and Needles, they provided us with many needed items, right, that we used in our programs. We were also able to deliver 50 car seats for those that participated in our program. So I'm just blown away that we're still able to do those things. The youth resiliency, which is a very important topic to us, keeping our youth happy and healthy, and a place for them to talk and a place for them to come and find alternatives to, or finding solutions to challenges that they might be facing. That continued with virtual talking circles. And we had over 50 participants. So that's really good to get teenagers to talk. That's really good. We had an Indigenous Readers Book Club. We had 30 active folks in that club. We have right now over 80 folks registered for upcoming sessions. So that reading is really becoming a popular program. So again, if you're interested in joining that book club, give us a call and come on in. Let's see. Our youth council, they also held monthly meetings. Let's see. Oh my gosh, they did some events. They did some Apache song teaching, some Dene song teaching. They promoted Walking Your Mocks Day. And upcoming, what they have planned is some sessions on ribbon skirts, beading, and making baby mocks. So baby moccasins. So they're working away, trying to provide that content for you all so that you can remain connected, learn something new, and still feel like we're here for you. How's that? Oh, the cookbook. I almost forgot about the cookbook. I love the cookbook. So we also created an Indigenous cookbook. I don't know if we have any copies available, but you can call our Native Health if you're interested, and we'll see what we have. Our diabetes prevention, our wellness warriors, those continued with video workshops, healthy cooking workshops. I think we had chair yoga at one point. Our wellness warriors held the virtual bike rodeo, our basketball fundamentals via video. We had like 49 videos, and out of those 49 videos, we had over 50,000 views on those videos. So folks are watching, and that's completely exciting. I can't wait to see everybody. I'm hoping that our open house in October can be in person. And that our annual meeting next year can be in person so we can visit. Let's see. In Harmony, they managed to continue to provide HIV testing by supplying home test kits. We had over 377 community members receive home test kits, so they didn't have to come in. The Arizona Long-Term Care Services, or ALTEX, they serviced 100 elders and special needs individuals from 13 tribal communities. So that is, virtually and in person when needed. So not everybody can access virtual Zoom meetings or telephone calls. So if we needed to, we were there. something that's coming back that we missed quite a bit was Native Talk Arizona, and it is coming back. They have built a space in Native Health just for our radio show. And podcasts are available through iTunes and Spotify. So I encourage you to get connected with those. Great topics. We've had many folks come on and talk about their experiences during the pandemic. Let's see, our mascot, Mr. or Miss, I'm not sure. Well, Berto, our little bear mascot, did travel safe during the pandemic and is looking forward to going out for new adventures and seeing what he can see or she can see. We're not really sure out there in the world. If you see Wellberto, take a picture and let us know. Send that picture to us so we can publish in our newsletter where Wellberto has been. A favorite activity of mine is the children's pageant, and we did hold it virtually this year. We had over 50 participants, and that video got over 10,000 views. I'm like, did the whole state watch it? That's amazing. So 10,000 views on our children's pageant, and of course all the kids got mailed their prizes and gifts. So that was pretty good. Many of the families recorded either on their home land or out in, like, I saw one, it was by a creek or something. It was amazing. They did an excellent job. I almost think we should do the videos, but in person or something, because it was so much better than the stage. I really loved it. The kids are so cute. Let's see. I want to make sure that I know Walter has mentioned many of our partners and our folks that help supply what we need and donate to us. He mentioned Phoenix Fire Department, Verizon's Native American People of Verizon Employee Group, United Healthcare, of course. They all help to provide sanitizers, face masks, all the PPE equipment that we needed. We have Hooks and Needles, been longtime supporters. They're always bringing us neato stuff they've made. One really important part of Native Health is advocating for changes in law or changes with Congress. And Walter does a lot of that, speaks in front of Congress, goes to conferences and meetings. But one of our big supporters is Ruben Gallego. He's a congressman here in Arizona, and he has fought for Native American and Alaskan Natives to be included in the COVID-19 relief package. So if we didn't have a voice, we may not have been included. So, we really want to thank him for his advocacy to ensure that we are included when they are talking about budgets and they are talking about assisting the American people, that we are of top of mind. And of course, we were included, right? He also was instrumental in helping pass a new law, ensuring Native Americans have access to affordable health care at both IHS and tribal health centers, especially veterans, to make sure that they get the care that they need and that we get the funding that we need to give them the care that they need, right? I also want to thank the Arizona Community Foundation, the Arizona Food Bank Network, I already said, Bank of America, Vanguard Charitable, and the Virginia Piper Charitable Trust. They all have contributed to Native Health during this past year and helped us to meet our mission. And just as a reminder, this is what we think about all the time as board members as we are trying to support and help Native Health meet the community's needs. We think about our mission, and our mission is to provide accessible, holistic, patient-centered care to empower our community to achieve the highest quality of health and well-being. We want our community to be the best community. So that is our mission, and that is what we strive for as we do our work throughout the year. And that's all I have. There's much more in the book, of course. So I encourage you again to pick up a copy of that book. And if you have any questions, contact us, and we would be happy to chat with you. Okay, drink of water. Next up is we are reappointing some of our board members. We're so lucky. I'm so happy that Tanisha Sangino and Carol DeHosey, whose terms were going to end this year, have agreed to come back for an additional 3-year terms. Thank goodness, yay. So we are reconfirming their appointment to the board for another 3-year term. Carol, I see, Tanisha came on right before me, and so we were new together. And then Carol, we were strangers, right? She met me with a smile on her face, and she was instrumental in having discussion with me to help us move some of our activities forward, such as metrics or reporting, so that we really understand as a board that we are doing our due diligence and maintaining Natives Health standard and moving Native Health forward. So thank you, Carol, and thank you, Tanisha. I appreciate you coming back for another 3 years. And I don't usually do all the talking, so this is weird. Is there any additional announcements or comments that you all would like our staff or public to be aware of?
I have one.
All right.
Hello, everyone. My name is Anna Jagelski. I'm a board member for Native Health. And I just wanted to tell a story that the other day I met a woman just out in the community, and she actually brought up Native Health without knowing my connection to the organization at all. And so I told her I was on the board, and she proceeded to tell me that she loves Native Health. It's been such a avenue for her to feel connected after moving to the metro area from her reservation. And she also said that her young boy, who goes to a charter school here in Central Phoenix, they invited his teacher to the Boys with Braids program that happened earlier this year, and that the teacher accepted and went to the program virtually and is actually going to be talking to her school board about implementing what was discussed in the Boys with Braids. So
wow,
awesome. Yeah, and it's just a great example of the connection that Native Health has with the community, and I love it. It's great organization to be with.
I agree. Good job. Thank you for that. That's inspiring. And that's what, that really, we were for a while there reading testimonials from patients. Maybe we can get back to that, because that's inspiring to do that for everyone. Any other comments or announcements that anyone would like to make? If not, it is up. Did I hear somebody?
This is Carol. And before the meeting ends, I just want to wish Dr. Wilson the very best in your new journey. And again, just like Jeannie and everyone else has said, it was such a pleasure to work with you. We're going to miss you. We're going to miss your quiet manner and your calming effect
Yes.
on the board. But I just want to thank you for everything and just wish you the very best. Your new venture is very exciting. It's really an honor to have worked with you. So thank you again.
Well, thank you. And Carol, as our paths have crossed in the past several times, I know they'll cross in the future as well. And I'm sure with you all.
Yeah, thank you.
Thank you.
Thank you for that, Carol. Is there any additional comments or announcements that anybody would like to share? Hi, Sean.
Hi, can you hear me okay?
Yep.
Great. So Sean Stowers, been a board member for 5 years now. And again, very unfortunate that we couldn't be here today with the surrounding community and audience, but absolute thank you to everyone over this past year. We know it's been a very challenging time, a very trying time for everyone, with families, with communities, with loved ones, with being distanced, with being apart, with mandates of staying home, with wearing face masks, with doing what you can to help out your fellow neighbors and doing the best we can given a situation that was very, again, challenging and trying for everyone, and somewhat of a new normal that we've learned over the past year. But definitely want to send an absolute thank you to all the Native Health leadership, the executive staff, all the providers, all of our volunteers, all of our staff, all of our workforce. You guys are the heartbeat of our organization, and definitely makes it what it is today. And without your ongoing sacrifices, we wouldn't be in a position that we are today. So on behalf of the board, an absolute bottom of my heart, thank you to everyone out there for continuing to make Native Health a great success story. And as Brianna had mentioned, positive stories like that are because of the workforce that we have in the community that we built. So again, a very heartfelt thank you to everyone. And also a special shout out and thank you and heartfelt congratulations to Dr. Wilson. It's been an absolute pleasure and honor serving on the board with you for the past 5 years. I know when I speak on behalf of the board, again, we can't thank you for all the valuable resources, information, and knowledge that you brought to the board, and also the ongoing commitment that you have to the community. And look forward to hearing from you in the future, and wish you the absolute best moving forward. So thank you.
Thank you, Sean.
Thank you, Jeannie.
Very nice, Sean. Very nice. Thank you. Thank you for that very much. Last call. Any announcements, comments? Well, this whole group is amazing. Leadership, board. This is my happy place. I will go to work for 12 hours and then come to Native Health and be completely happy. I'll be burnt out, come to a meeting and be happy. So this is the best organization on the planet as far as I'm concerned. So I thank you all for being here tonight. And again, if you have any questions, comments, please contact us and let us know. And we're here for you. And get your vaccines. Get your vaccine. It doesn't hurt, just a little bit. It'll be okay. All right, everyone. I'm going to adjourn this meeting at 5:48 p.m. Have a good evening, everyone.